Most healthcare startups ask, when do we need compliance? What if the better question is, how do we build with it from the start? Today on The Compliance Advantage, we're talking with Dr. Jasen Gundersen, CEO and co-founder of CardioOne, a practice enablement platform supporting independent cardiologists nationwide. Jasen brings a unique perspective as a former practicing physician who's led teams across academic medicine, hospital operations, and physician practice management. In this conversation, we explore how CardioOne built compliance into their foundation from day one, growing from 4 people to 180 employees in just 3 years. Jasen shares candid insights on educating physicians about compliance, finding the right compliance partners, and why he views compliance programs as essential infrastructure, not optional overhead. You'll discover how compliance creates preferred partner status with payers and hospitals, why problem solvers make better compliance leaders, and practical approaches to building compliance programs that support innovation rather than stifle it. If you're leading a growing healthcare organization and wondering how to scale responsibly, this episode offers real-world wisdom from someone who's done it successfully.
Welcome to the Compliance Advantage podcast. This is where healthcare executives transform compliance from a burden into a strategic asset that drives both growth and peace of mind. I'm your host, Ross Ronan, founder of Ronan Healthcare Compliance and a healthcare compliance strategist with nearly 30 years of industry experience. I'll help you stay ahead of evolving regulations while building the sustainable, compliant organization that lets you focus on high-level strategy and exceptional patient outcomes. Remember, compliance pays dividends. Invest today. Today we have Jasen Gundersen, and I really appreciate you joining me today.
Thanks for having me.
Yeah. So Jasen is the CEO and co-founder of CardioOne. Again, tell us a little bit about yourself, where you came from, and what you're doing today.
Sure. So I was a doctor. I mean, I'm always kidding around about that. I still am one, but I was a practicing doc. I kind of grew up my career and started off in academics and then got very involved in working with physician groups and left my academic role, was at a big company called Team Health, managing physicians all over the country. Did some work in value-based care, kind of grew up working with docs across the country in different roles. And then a couple of years ago, met an investor in New York, and they're very interested in doing something in cardiology, value-based care.
Yeah.
And that's a passion of mine for personal, professional reasons. And so we founded it 3 years ago, and it's been a rocket ship ride. And we're a practice enablement platform built to support independent cardiologists across the country. That's the fast version of what we are.
I like it. Is it only value-based or is it also fee-for-service?
No, so this is the interesting thing, right? The world that we live in is like all fee-for-service,
right,
and then there's value-based care. And if you ask like 100 people for a value-based care definition, you'll probably get 500 answers,
right,
if you're lucky. And so what I like to say is, in having worked in value-based arrangements, a lot of people don't struggle with them because we don't have a really good system today. Like if you look at things like access, you call up and you see a cardiologist, it's 3 months.
right.
There's no program that will support you at home. So like I was an ER doc and a hospitalist.
Right.
People would come to the ER because they couldn't get seen. So I like to use the term, we solve for today and build for tomorrow. So we solve for today's fee-for-service challenges.
Good.
Things like access, virtual care, in-office testing. All those things are really good for the docs because it's a good business model. Happy patients come in and get seen. They're also significantly lower cost than big healthcare systems. So we solve for things like access and
right,
testing. It does well in the fee-for-service environment, but it preps them and makes sure that they have all the tools so that when you are responsible for patients on a more, instead of value-based, outcomes-based,
sure,
you have it. Like you have a virtual care platform, you have in-office testing, you can actually manage those programs. A lot of people have jumped into those environments without having the tools, and then it doesn't work and they wonder why. So yeah, that's why I used to term, we solve for today, build for tomorrow.
I like that. And it's amazing that I always wondered why they call it value-based reimbursement or value-based care. And I'm like, no, it's really outcomes-based. You want people to keep going back to the hospitals or keep getting sick. You want them to get better. And that's really where it's at.
Yeah, I don't know where it came. It's a bizarre word for it.
It's a
Because I think
Medicare
it's just like I just tell them, like it's just being paid for outcomes. And if you think about it, like I like analogies. I use this one all the time. If your transmission broke in the car, you could stop and have it fixed.
Sure.
It would be expensive. It's inconvenient. Think about all the challenges. Now, if you picked up your car and drove down the road 8 days later and the transmission fell out, and you went back and they said, oh, you got to repay for everything again, no one would tolerate that, right? But in healthcare, that's fundamentally the system. It's kind of crazy. So that's where I hope we get to. There's some models out there and other specialties that are a little bit more advanced, but we're really driving the path on CV care.
That's great. We're going to talk a little bit more about compliance advantage in healthcare, and we do talk about that quite a bit. The different types of reimbursement as it relates to compliance advantages. Obviously, there's different kinds of risks when it comes to value-based or outcomes-based reimbursement versus fee-for-service. You've been a practicing physician. Now you're the CEO of an independent physician groups that helps them navigate the waters of all the complexities, right? They can still get to practice, but you get to help them navigate the other pieces of it. How do you look at it, and how do you help these independent physicians and practitioners really understand the need for compliance and it really being an investment in prevention versus a cost of doing business as something that you have to have? And I know you've had a lot of experience in compliance, and so maybe tell a little bit about that and then dovetail that into a little bit of how you talk about with those independent physician owners and those practices that you have, how compliance is important and in their advantage.
I think a lot of physicians when they hear compliance are like, oh, yeah, but it's fact of life. Yeah. Our medical billing reimbursement world is ridiculously complicated. Mm-hmm. It kind of evolved that way because I think in the past people have done things that were not so good, and then the government gets involved, and so we have these rules, and they're the rules that we have to work in. And you can complain about them, but that's just life. I think we docs need to want to have a compliance program. They really need to want to have someone to help them make sure that they're working through this very complex system. Because the last thing you want to do is be on the news for a compliance problem, because nothing will degrade your brand and your trust from patients and payers and everybody faster than making a mistake or not keeping an eye on it. And so I think that that's really what we try to work through. And I don't think it has to be complicated, but it just needs to start with the basics. And it's not there as like policing, but it's helping navigate what is a very complicated set of rules and regulations.
There's this philosophy out there, at least in the compliance world, there has been for years. And I think it's how the construct of compliance was set out by the OIG is scare tactics, fear mongering, trying to tell everybody you're going to go to jail. I mean, I don't know how many times a day I hear, I don't look at an orange, and I kind of roll my eyes a little bit. And I'm like, you know what? That's not really the concept here. The concept is exactly what you said, which is we put into three different categories. We call it the 3 Ps. One is patient trust equity. When patients start seeing your name all over the news, guess what?
Yeah, that's not good.
Stop coming to you. And that's a huge thing.
It's huge. There's a lot of like skepticism around healthcare in terms of what things cost, largely because it's an enigma to me what things cost, because there's all this world out there. So I think you want to be in the news for like having great access or some great patient outcome. You don't want to be in there because you coded something the wrong way inadvertently, and then you end up in trouble. And I do think we need to figure out like how you work through those areas and how we can help physicians who have a lot to deal with, like solve for those issues. So it just becomes automated.
It's amazing when patients do see that people have done something wrong in the news, that they think that they might be done wrong by that same person. Like if you're overcharging the government, you have fraud in the government, how do I know that you're not ordering tests on me that I don't need to be run, or you're making me pay extra on something else? I mean, that's really a reputational issue.
Trust is everything in healthcare, right? Once you violate trust on any one thing, everyone starts to wonder, oh, is this other thing? What's going on? And I think a lot of those instances are, granted, there's bad actors, which get a lot of bad names out there, but a lot of it is just not knowing what the system is and how to do it.
Do they feel comfortable like focusing on something other than patient care when you're talking about compliance as ROI or something like that? Or are they just like, hey, I want you to handle that, and I want to just focus on my patient care. Just tell me what to do. I'm fine with that. Just let me focus on what I do best.
Most of them are like, just tell me what I have to do. because I don't want to have to think about it. That's like, there are people out there like
course.
us, and that's what we do. We're using systems and tools to like get in front of a lot of that and make sure we're on top of it. But no, docs don't really want to think about it. Like some of them are like, why do we have to have that?
Right.
That's one of those things, like you want to have that so you don't end up in the news.
You definitely don't want to be on the front page of that. So when you talk about strong compliance programs, creating that competitive advantage, one of our other P's is preferred partner status, we call it. And that is really, do hospitals want to work with you? Do other providers want to work with you? Do payers want to work with you? And you build this kind of preferred partner status to say, because you have a good compliance program, because you're a compliant organization, you're not getting in trouble, I prefer to be your partner on certain things. Do you see that as being a competitive advantage with CardioOne?
Absolutely. One of the first questions, we went out and did a fundraise. How are you handling compliance? What are you thinking about that? For me as a company. But I think from the physicians that we work with, they're looking for referrals. They're looking for hospital relationships to do procedures. Some of them are looking to borrow money or build out surgical centers or imaging suites. And knowing that they're doing that in a compliant manner from the get-go makes a big difference. So I think docs don't think about it right away, but someone like, we want to build an imaging center. We're like, okay, it's not just like go and do. There's rules around that, but then we kind of guide them through that. But you definitely don't want to get one hit. I mean, I keep telling everybody that is like, you just need to prove to folks that you've got a system in place and that you're thinking about it. And I would say compliance is not a one and done. A lot of people think like, well, I did my piece and I'm done. I'm talking to the expert, but like, I feel like it's a moving target. Every time you get one thing done, there's something new. So it's about learning, training, and I really think it's about systems so that it becomes just ingrained. Like we have done a lot of work on like patient safety around like medication reconciliation or wrong site surgery and about systems in place. Just like you get on the plane, you hope the pilot doesn't feel like, I feel like that seems okay today. I'm just going to jump on the plane. But like there's a checklist and a system. Right. So I think if you have a compliance program that just becomes automated, we go through TSA, we follow the same thing all the time, right? So I think that's just making it automated so it doesn't feel like it's something done on the side.
It's a living, breathing thing. It needs to actually do something, not just sit on a shelf, and it always needs to morph with whatever's happening in healthcare. And I think that's the biggest piece that you have to look at from that perspective.
Yeah, that's probably like if I had to say our challenge, as it may be, is having partners that can help guide us around, this is where things are headed. This is the rules around this. This is how we can write a contract that's compliant. Like we think about those things, but it changes. It's a moving piece. So I think always finding a way to keep up on it. And that's why independent docs, and that's why in cardiology, it's like 85% employed now. Right. It's hard. If you think about just the business or the contracting, but you throw something like compliance. And so we try to solve for as many of the kind of non-clinical components so that they can really focus on the medicine side and those things become automated.
And cardiology's got to be primarily government-based reimbursement.
It's a tremendous amount of Medicare. Right. I mean, just most
nature
of our
the
patients,
business.
Right. Most of our patients are older and they're all on Medicare or Medicare Advantage and they're on those programs. And so we see a lot of those. And then we have a lot of docs that do interventional procedures and cover like heart attacks, STEMI call. So we get Medicaid, we get uninsured. We get a very broad range of payers in that mix, but it's a significant amount of government.
When you talk about preferred partner status, do you guys look at anybody that you want to partner with and go, are they doing the right thing? Are they, like, whether it's a hospital that you want to be a part of or it's another physician group you want to be associated with? Do you guys look at their stuff too to make sure they're not like in the news and bring you down?
Yeah. So I will give you, this is an interesting component. Personal passion of mine is this whole concept of remote care and virtual care. Yep. So a lot of times, like when I was seeing people, they'd come in, they'd leave, and then they were out in the ether. Blood pressures and heart rates and all these other things. So there's a remote patient monitoring came online. And to me, it's a significant opportunity for us to solve for today. It's a billable event today. Sure. But if you're going to manage risk, you better have a remote monitoring. We worked with several companies that we were like, oh no, hard stop, we're done. I mean, it was not compliant. Like they were doing things I was like, oh no, we don't want to be a part of that. And so we actually built our own.
Oh, good.
because we struggled with finding someone that we felt was the best operationally, compliance, and for the patients, like all three. But yeah, we ran into partners where we stopped several.
Isn't that amazing though? It's all of that piece, and people don't realize and understand that, where you just invest in a compliance program and you probably could have won that business. Probably could have won CardioOne's business. And
yeah, I mean, it went from a tremendous opportunity to zero.
Zero.
And, our docs didn't notice it right away. And then when we, they didn't really think about it. They're like, oh, this is great, getting revenue in the door. And we're like, take a look at this. And they're like, oh, my patients are going to be pissed. And I was like, yeah. So, no, we definitely look at the people we partner with, because if I come to you and say, hey, I want to work with you and manage your practice, if I bring somebody in, that is a direct reflection on me and our 100%. Company. People don't say, oh, that's separate. So yeah, it has made a big difference. So we look back and forth. And I think the companies that we've worked with, that we've built more substantial arrangements with, have actually looked at our programs to say, hey, are you doing the right thing? Are you thinking about those components? So yeah, it goes both ways, but we've definitively ran into things where nope.
It's amazing. It proves the point, I think, from the big perspective. Let's dovetail a little bit into liability, because I think that's really an important discussion, because you mentioned it a little bit when you said, I make a referral, it's a reflection on me, or I want to bring a partner in, it's a reflection on me for the company. When we talk about liability as being an advantage, I think most docs, most executives, CEOs of either MSOs or different PCs or even hospitals need to realize and understand that they do have a personal liability, because the Yates memo came out a number of years ago, Sally Yates, indicating that if you do wrong, we want names. We don't want just entities, we want names, right? And so how do you address that with your docs that you're working with, who are your owners of your PCs, and how they kind of reflect on you on that liability standpoint? Do they understand they have liability? Do they know what that is? Do they take that into account as being, wow, compliance programs gives me that advantage to limit my liability that I might have?
It's a little bit of both.
Okay.
It's about educating.
Okay.
I think when you first come in, if it's a fully independent group, or that's never thought about it, I think they view it as oh, all these controls and this compliance work. So it's really about, again, trying to simplify it as much as possible. I don't know that a lot of docs really understand. Like I said, most of us, we're not trained in right. business, or
you don't have a compliance program in medical school that says this is compliant.
Oh my! I mean, I kid around. My wife's a medical educator,
sure.
And sometimes the students we'll get together, and she's like, you can't come by, because she's like, you'll scare them. They don't know what you're talking about. You're talking in a whole different language. But I don't think people are really trained well in that. Yeah. Some places do a good job of it. I've seen health systems, but sometimes I don't think they educate on it. They just do it on the side and no one's aware. But we do try to tell them that there's risk to it from a liability standpoint. If a commercial payer thinks that you're off kilter and you get the ban from Blue Cross or get a sanction from Medicare, that will never go away, ever. It will follow you, and then it snowballs, and you really want to be on the right side of it. So I don't think people really understand about it. We try not to scare them. We try to tell them this is what we need to drive towards, and this is how we're going to do it.
That's the hardest part, right? Is not taking the scare tactics, because when you talk about liability, no one wants to have liability when it comes to anything, really. They don't want to be responsible or know that they could be in trouble. And so that's a very hard line to walk, because you don't know what's going to make sense to somebody or what's not. So when you talk about kind of creating that advantage, compliance advantage, when it comes to the liability pillar that we talk about, it's really about creating those guardrails where people, docs, hospitals, practices, whatever, can function within their guardrails so they don't feel like they're going to have that liability. And that's really the advantage, that they can go faster, they can go quicker, they can do RPM, they can do MCT, they can do all these other different varieties of things that are different healthcare practices that might be a little risky on that standpoint, and I don't really want to take that risk. So, I mean, how do you make those kind of communications?
Well, I think that's a great point, because what you don't want to do is scare people into doing nothing, which, frankly, a lot of our U.S. healthcare challenges, everyone's so afraid of doing something, we either don't do stuff or we test people from here to oblivion, right? So you don't want to say, oh, we're not doing virtual care. It's not worth it, because then you're missing an opportunity. So it's very much about like, this is safe,
Right.
and this is how you do it. But you go and tell docs about a few things, they'll all be like, we're not going to do that. Like, we're just going to stop, because they get like reactive, fearful of it. Like there's liability in healthcare, everything we do. There's a lot of ambiguity and histories and movement. And so you have to just give people like the safety and security. You give people the bumpers and you work in there and you know you're good. But we also have a tool where if you want to do something else, come to us. We have a team. We will go to the lawyers. We will work with our team to research it and then find the way to do it in a way that's compliant, safe, best outcomes. I don't want to stifle innovation. That's the part where everyone's like, well, I'm just not going to do that. Like RPM, oh, it's too risky. I'm not going to do it. So patients don't get it. It's very much about finding the zone in there. But everyone's afraid of it.
It's a lot like compliance. Reactions to compliance are the same kind of same thing we see in reactions to med mal claims. Yeah. It's a knee-jerk reaction. I'm going to stop doing X because I got sued for that, or I didn't have the guardrails in place in compliance, and therefore I'm not going to do RPM, or I'm not going to do MCT. I'm not going to do those things because OIG is looking at it, or I get risk assessments, or I get UPIC audits that are out there calling me on the carpet, having me return money. When in reality, you just need a program in place to make sure that you are comfortable. It's the same thing that you said with med mal. The wrong side surgeries, right. Drug issues wrong medications, whatever. It's the same concept. You just have to have the right controls into place to make sure you do the right thing. And then you can actually practice medicine the way you want to practice medicine.
Yeah, that's what it's all about. There's so much regulatory challenges out there in terms of everything from like what medications you can prescribe based on formularies. I mean, there's a lot that the docs are trying to work around. And then it's just figuring out like, hey, this is how I can do it in a way that works. And then there is the educational side of it. So like coding is an enigma. I think it's an enigma to
no one knows how to do
it. Right. So you try to do the best, or we do coding audits and we go back and be like, okay. And docs are all like ridiculously competitive, right? And so, I mean, right, they had to like try to get into medical school and residency and everything else. So nobody wants to be like not perfect. So if you actually go back and give them education, they're like, oh, no. I want to do better. Like, I think it becomes just part of it. But it's the challenges of it. But I think ignoring it is what a lot of people either do. It's just like, I'm not, or they don't think about it and they don't realize the ramifications from the business standpoint or trust standpoint. Like, if you have get challenged, no one is going to refer patients to you because they don't want to be associated with that, because then that'll be a reflection on them, just like my partners reflecting on us. So I think docs, we just have to realize that that's the world we live in and work in, and we want to make sure we're doing things the right way.
This episode of the Compliance Advantage podcast is brought to you by Ronan Healthcare Compliance. At Ronan Healthcare Compliance, we believe in transforming healthcare compliance from a checkbox attitude to a strategic advantage. With decades of expertise, our team of consultants provides innovative solutions tailored to your organization's unique needs. We don't just help you meet your standards. We elevate your business, ensuring ethical practices are at the heart of what you do. Whether you're navigating complex regulations or seeking to enhance your compliance strategy, Ronan Healthcare Compliance is your partner in achieving excellence in healthcare compliance. Ronan Healthcare Compliance, redefining compliance, empowering leadership. Visit us at ronanhc.com to learn more. Now, back to the show.
I like this idea where you talked about the education piece of it. And one of the 7 elements is education and training. But I think what you're referring to and what we refer to is more like the compliance officer. We call them compliance executives, not compliance officers, because the people that we train and put into place are people who are strategic partners to the organization, not the CFNO, the people who are going to tell you don't do things or whatever it may be. And I think a lot of that education, we'll call it training, we'll call it education for liability, for whatever, comes from a really good strategic partner as a compliance individual. Right. When you see that as being advantage, when you're looking for a compliance leader, what do you look for that actually becomes, that person then becomes your kind of side-by-side, pretty much CEO, for God's sake? You got to have someone sitting beside you going, Yes, no, maybe. Let's figure out how we get this thing done. Tell me what you look for in a compliance executive.
Well, we were a startup, so there's a period of time where
Sure.
we were like the CEO of everything.
Of course.
To me, there's two parts of it. First, they have to have an interest or passion in it, about it. Like there has to be this idea that this is something we need to do, that we want to do, and that they want to have some ownership for it. And two, I look for problem solvers.
Right.
Because what I don't want, I like the CF no. I don't want like someone to come in and be like, nope. Like I always kid around, there's two types of lawyers in the world, those that tell you what you can't do and those that tell you what you can do. Mm-hmm. So I look for someone that is interested in it. My COO happens to be very interested in it and passionate about it, but looks at it from a problem solving standpoint. And usually those people have either had some experience with it in the past where it's either gone really well and prevented something, or there have been challenges. Like I've had to deal with one of those in the past. And so it's just about interests and then problem solving. And it's that iterative process. So how do they interface with our legal team and translate, this is the legal issues and this is the operational issues, and this is how I make the two come together. Because you just can't go out and say, these are all the rules, no one knows what to do with it.
Yeah, it's hard to have a COO that's really into compliance too, because you'll run into a conflict of interest at some point in time. Something's going to tear that person apart. It's the same thing with the financial person. But it's really nice to have somebody and operationally understand what goes along with compliance and can actually have that conversation if you want to go into a new state or you want to try a new RPM services or something of that nature. Somebody's sitting beside you going, all right, strategically, we want to do this. These are the kind of the pitfalls. These are the kind of the risk factors that we see. And have you had difficulty finding the right people? Have you been in a position where you've had the wrong person before?
As a startup, we've probably not had enough people. We had a compliance committee by year one we were talking about. We had a formal compliance committee that reported to the board by year two.
That's amazing.
So it was something that we knew, probably from my background, that
Sure.
like we need to just be aware of it. And so we had legal counsel that worked with us. There's a group of us executives that all do it. We have an outside board member that sits on the compliance committee. We meet once a quarter. Our head of people ops actually stood in as our compliance officer for a bit. And then we built a compliance hotline, email and phone. It will all roll. He was like, I'll take the first piece. And then he would work on the investigations. And it was amazing. We put it out there. We had people calling, and one of the docs was like, "Oh, they're telling stories on me." I'm like, "No, they're actually doing their training and citing things. And by the way, we investigated them, and they're all good. And now we solve for it." So yeah, it's always a work in progress. Yep. Especially I would say we're a tiny startup, but we're pushing 180 employees now.
It's not tiny anymore.
No, not in 3 years.
That's amazing.
Yeah, 3 years ago today, I think there were 4 of us.
That's incredible.
Our team was just in town last week. It was great to see the corporate team is 37 now. So everyone's kind of pitched in and owns it. And we've got a great board and great investors that were active in it. And we partner with folks. And there's a lot we want to do. But at least we're where we are, and we're going to continue to advance.
Good for you. You don't hear that very often. And I think that's probably one of the reasons why I wanted you on the podcast today, is the fact that you've had that experience. And about the third or fourth thing, whenever I meet CEOs who understand it, third or fourth thing they put into place is a compliance program. After they know how to make money, after they know how to generate revenue, they go, how do I protect it? How do I keep it? How do I lawfully keep the work that everybody's doing and then the money that I've made? And so kudos to you for putting that right off the bat. Even if you don't have the compliance executive, a compliance committee is a huge purpose to be able to understand and how to have oversight over the compliance program.
It was important just because, I mean, I don't know what I don't know.
Sure.
I'm like, this sounds like a great idea.
Yeah.
And then they're like, no, you can't do it that way. You got to I'm like, okay. So but again, it was one of those how do we solve for it and then bring it back? And I think we're always thinking about it. Again, young, early stage startup, the fastest way to kill all momentum is to have a hit.
Yeah.
Or have someone even question it, even if there's no issue found. That, someone thought something was there. I want to be in the news for great podcasts and sales and brand. I do not want to be in there because someone questioned what we did. If it was the right thing to do, that would be the worst thing ever.
And perception is someone's reality.
Absolutely.
No matter how you think about it. And so you really have to work with them to make sure it doesn't become reality if it's really not, and get to the bottom of it. And I think that's great. And we talk about doing risk assessments or not knowing what you don't know. You guys take that into account when you say, like you said, you went out and you did a fundraise. So that's really important to be able to do that. With that, you have to know what you don't know. And so did you guys do a risk assessment? Did you guys look at your business to figure out where your kind of potential, I don't know, failures might be? Or
we work with different counsel. We had a team of lawyers that we worked with on our startup. And they helped us with contracting. And then as we started to go into new states, we had to learn that, like, okay, you can't do it in New York, what you do in New Hampshire. And so we would, whenever we went into a new environment, we would send it to them and say, hey, we're going to this environment. What are the do's and don't do's within our contract arrangement? How we would structure fee schedules and the rest. And so it just started there and it kind of expanded. And we've partnered with different legal advisors that will step in and help us along the way. And then we've tried to find the right one that fits the size and scope and the space that we're in. I think that there's a couple areas, like we think of compliance, like how do we build our legal structures? And then we think of compliance, like how we operate the physicians, and then the compliance, like how they do billing and coding. And so we have differing approaches to that. We've expanded service lines. So like I said, we're doing virtual care. We're building enhanced imaging centers with PET CT and CT angios. Talk like a doctor, forgive me, but it's fancy stress testing.
I understand. You forget I was a nurse at one point.
But sometimes for the audience, they're like, what is he talking about? So there's different stress testing, but like how we build imaging centers, because our docs are like, hey, we're going to build this imaging center, everybody can come. We're like, no, we got to figure out how to do that. And so we've learned. And so when we launch a new service line, we've learned and gone out and done research and then try to make sure we're setting up our structure primary. Because again, if we are building relationships that aren't compliant or we're not thinking about, how am I going to go back to the docs and be like, oh, by the way, you need to do this. So we have to set the example that really got it under control when we start off and then work it down, because it starts with we build a contract and then we build the service lines. And then once the practice is running, how do we make sure they're doing all the right components? But if we didn't start at the top, it's very hard to go back and say, hey, this is how you're doing coding or referrals. And they're like, what are you talking about? So setting the example.
Yeah, that risk assessment is so important to be able to understand what your risk factors are, how you're going to deal with them. And I think it's great to say, how can somebody trust me to do the right thing if I don't even know what those risks might be before I ask them to jump on board with me? And I think that's a really important point to make from the independent physician practice management group, like where someone's trusting you with how to run their practice and how to do that work.
I mean, if we screw up, like they don't get paid. It's
their MPI's billing too. It's their name.
It's all associated with it. I think we went through a fundraise, which actually was an acquisition. So we were a very fast launched acquisition. And so when we went through that acquisition, like our new investors did their own review of our policies, procedures, compliance. And obviously we passed the test because we were acquired, but then they actually said, hey, by the way, this independent reviewer on top of yours identified these kind of areas. And so we're always learning. I think that's the thing, is like you just always have someone looking at it, checking ourselves. We check the docs, someone checks us.
That's a great relationship as it goes together. Now, as we close here, when you think about kind of CEOs or new CEOs that are in your position, you've done a lot and you've been around the block, I would say, and in both healthcare and practice management and compliance world too, because we had conversations about your prior life and what you've had to do from a compliance perspective.
Yes, I do not want to do that ever again.
and I appreciate that, because not too many docs have actually been in that position. So I appreciate that. What information would you give to somebody who wants to do what you do, or they're a new CEO for a physician practice management group or a hospital or a big group? Like when it comes to compliance and looking at it as an advantage, what would be your kind of takeaways for them?
So I'm a startup junkie. Someone used the term when I was just talking to, like, love to build and start components. And I think you meet, especially startup CEOs, which I'll use that because that's what I am. It's fun to build and sell, right? It's fun to have new widgets and new things. And like, that's what we all love to do. Even if you are not personally like passionate about it, get a partner or an advisor that's going to help you think about compliance. If you're in healthcare and you do not have someone with an eye towards thinking about compliance and how you're going to work these things, you will be in trouble. So There's the fun stuff is like, I love launching new service lines and building the program up and watching the team grow. But like you need someone that works on that. And you have to pay attention to it. Healthcare, I'm sure all my CEO colleagues and friends in other environments be like, ours environment is hard too, but healthcare is really hard. Yeah. You got so much government involvement. You got so much government payer in it, complicated laws. And you deal with patients that have medical, you do not want to be on the wrong side of it. So carve that part of your brain out to take the time to build it from the ground up and think about those components. And then, like I said, get a really good trusted advisor or firm or someone that can be like, this is how you do these things. Find that team that tells you what you can do and build it from the start. I was very fortunate. My co-founders and I were all healthcare folks. My CFO was one of the employee for at Village MD. And another one of my folks was at Privia. And so we all had that mindset of like, hey,
been there.
There's a lot there we need to be thinking about. And so, yeah, CEOs is schizophrenic. You're like trying to do everything all at once, but you got to figure out if it's not you, that doesn't mean you can't ignore it. Just find someone to do it.
Yeah.
And it's going to come for you because you're going to need to raise money or get an investor. And that's going to be like, they'll check all your financials. There will have someone double check that all the compliance components are there because the financials are not real if there's not a compliance program. So it's coming for you. The sooner you have it, the better. We were a public launch to acquisition in 15 months. So had we not had it in place, it was coming. So it's coming. Just get in front of it and think about it from the start and just make it part of the DNA. Like that's how we view it. It's part of like who we are. We want to make sure that above all, we are doing the right thing for our patients, right thing for our providers, right thing for our investors, and doing things the compliant way is the only way to do it.
I love the mindset. That is exactly what needs to happen. And we often say one of our first pillars is make the investment. Set it, forget it, and then build on it as it comes. You start to think about it being, oh God, I don't want to do this, or someone's making me have it, or it's a cost center that I don't want to have. And you just like set it, put it in there. It's like car insurance, right? No one wants to have car insurance. No one wants to pay for it, but you know, when it's there, it's there.
I just used that analogy today. I'm like insurance, like no one's like super psyched about insurance until your car gets it.
Exactly.
Or there's a fire, or there's like, then you want it to be 100%. And so it's just part of life. You just have, if you're in healthcare, you're dealing with that. That's just the way it is.
And patients are affected. And I think to your point, there's a lot of regulations out there. Airlines big, finance is big, and healthcare is big. Those are the top three, I think, that have the most regulatory pieces on it. And what happens if your airlines fail? People die, fall out of the sky. Finances, they lose all their income. And then healthcare, they lose their health. They lose their lives. And I think those things are really protected from a regulatory perspective. And fortunately or unfortunately, that's what we have to live with. So, yeah.
And I think healthcare is getting prohibitively expensive. And we built our company in this whole idea of like patient responsibility, copay, co-insurance is going up in a very steep climb. So as patients are now, it used to be like everyone's part of an HMO or whatever. And I used the buffet analogy, like, hey, I paid my $50, like whatever, I'll do whatever. But that's not the case now.
Right.
You're seeing high deductible plans and everything else. So patients are starting to look at it like, do I need this? And I'm glad that patients are taking more ownership of it. But there's that component where patient is a consumer, not just like, no one ever viewed it as choice. Like you're like, I'm going here. People are starting to look at that, like how much things cost. Do I need to have that? Like, why am I being charged this? And we're starting to, I mean, God, I think I torture my providers around it, but it's a valid point now that I think people just from a growth customer base standpoint, like people are starting to look and be like, why does this test cost this much here and this much here? And why do I need to pay this and not that? And why did you charge me for this? And if you can't tell them you're 100%, that's going to be a problem.
And I think they're looking for quality too.
Yeah. They want to know that like, do I need this? Is this going to help me get better? And is this the right thing? Am I getting good quality? Like that's what everyone wants to know.
Right.
I think over time, like I'm getting old now, like when I first practiced, people weren't really thinking about that. Now it was like, whatever, I'm going to go wherever. Right. People are much more, people look at reviews, people go look things up. You will find it. So you want to make sure that your patients are getting all the value that they want. I think I'm really glad that patients are starting to look for that value rather than just kind of accept that it is what it is.
So Jason, last question that I always ask all my guests, what do you do to take care of yourself? We always think that health is wealth. So we always like to be healthy in the healthcare arena and like to hear what people do to take care of themselves.
That's a great question. It's a huge passion of mine. So I was a former very overweight person. So
Okay.
I'm probably down 190 pounds since my max weight. So I carve out time to get my exercise in.
Mm-hmm.
That's like a priority. It actually goes on my calendar.
Oh, nice.
And so I'm a cyclist, cross-country skier, pretty much outside whenever I can. But I think that's like so important. I travel all the time. Got to make time.
I love that. I love that. It's hard to do when you're traveling too.
People talk about like, oh, I'm on a diet or this. Like, it can't be a diet. It's a lifestyle. Like my wife and I both have that. We were on a motorcycle trip and it's early in the morning. She's like, where are you going? I'm like, I'm going to go to the gym. She's like, oh, I'm coming too. And so we just like, our friends are like, you went to the gym at 6:30 in the morning? We're like, yeah. But it wasn't like a work. It was just part of life.
Makes you feel good.
Yeah. I mean, I have this thing, like if I'm going to be a physician in healthcare, like I want to model to my patients and coworkers. And listen, I'm not perfect, but that leading a active, healthy lifestyle and how you manage it. So it's a huge passion of mine. Preventative cardiology is like why I got into all this.
No, I think it's a great response, because if you're going to be in healthcare, like you said, if you're going to be a doc, you should be healthy.
You should model what you want your patients to do.
Exactly.
And then it's honest, like you can have that conversation with people like, hey, it ain't easy, but this is what I'm doing around it. So no, it's a big part of my life and like what I try to encourage others in.
We have our team meetings every week, and that's how we end every team meeting with every person. We ask them what are they doing to take care of themselves this weekend. Those are great insights. And Jason, thank you so much for joining me today on the Compliance Advantage. I think that listeners will take a lot away from what you've done, what you've built, and your perspective on compliance. So thanks for joining me today.
Thanks for having me. It was great. Appreciate it.
Thank you for listening to today's episode of the Compliance Advantage podcast. If you enjoyed it, please rate, review, and share this episode with someone who might benefit from it. Don't forget to visit us at ronanhc.com for more resources and connect with us on social media for the latest updates. And remember, compliance pays dividends. Invest today.